Hi, I'm Dr. Rasya Dixit. I'm a dermatologist practicing in Bangalore from the last 15 years. Hair dye dermatitis is a very common allergic contact dermatitis which happens to one of the ingredients which are present in hair dye called PPD. Now, a lot of people are actually allergic to PPD and they do not know about it. What they do experience some amount of tingling, irritation and burning of the scalp, they just attribute to some of the chemicals like ammonia and they disregard it. But hair dye allergy or hair dye dermatitis can be very severe. It can even be life-threatening. So what are the symptoms that we usually look for? Patient usually comes to us and tells us that they have got a itching or a redness of the scalp, sometimes even the face, ears, neck area, 1 or 2 days which develop immediately after a hair color or which they have applied by themselves or they've gotten applied in a salon. On examination, we can see the skin is very red and it is swollen. Sometimes it is infected and it's discharging some pus, and sometimes even the eyelids are swollen, the ears can be swollen, sometimes the whole face is swollen. So what is this due to? It's like I mentioned, an allergic contact dermatitis to this ingredient called PPD. So does this happen only after the first application or after 10 applications? See, this allergy usually takes time for it to build up. Though it is known to occur even at the first time of application, it usually becomes more common after it has been applied a few times, maybe 5 to 6 times, then the allergy becomes known. So people try to manage it by taking some antihistamines, but it can suddenly become much worse and out of proportion. What we recommend always is to do a patch test with the hair dye that you are applying. You can do this patch test on your inner forearm or on the behind the ear, where you apply a little bit of the hair color, wait for 48 hours. If there is no redness or swelling in that area, then only proceed with coloring your hair. Second thing is, if you notice any redness or swelling after the allergy, stop coloring your hair. Ask your dermatologist to refer to you some PPD free hair dyes. PPD free hair dyes which are known and available easily in the market nowadays. Some of them, like the organic hair dyes, can also be used, which are completely PPD free. They will be based on either indigo or henna, but not to use any of the commercially available preparations which contains these PPD. If you develop the allergy, you need to immediately speak to a dermatologist so they can give you topical antibiotic, topical steroid, if needed oral steroid and oral antihistamines to make sure the symptoms get better. If you are suspecting a hair dye allergy, please speak to the dermatologist immediately.